Aloha and welcome to the Kupuna Connections television program. I'm Cullen Hayashida and I have with me our special guest to talk about issues having to do with end-of-life care and how can we help our doctors. This is, I think, is something that has not been well addressed in the past, and so I thought this would be a great opportunity for us to talk about this particular topic. So with me is Jeanette Kojane, I'm sorry, Jeanette, with Kokuamau. Jeanette, could you share a little bit about who you are and what you do?
Sure. Well, and thank you very much for inviting me here today, because for us this is a very important conversation, and we really look forward to talking, you know, not only with you but other people who are watching to help people better understand the issues that we're talking about. Kokuamau is the state's hospice and palliative care organization. So we work across the state, and we're a membership organization. So all of the hospices are members, but so is HMSA and Kaiser and UHA as healthcare providers. We have a number of hospitals that are members, like Castle and Queens. And then we also have all sorts of individual organizations, as well as individual people that work on this issue.
Oh, okay. So Kokuamau is kind of like an umbrella organization and addressing issues having to do with end-of-life care, palliative care, and that sort of thing. Some things, of course, that are oftentimes very sensitive to talk about, but of course very important, particularly for our loved ones. You know, this whole area seems to be filled with a lot of different kinds of topics that oftentimes, sometimes creates some sparks or some controversies. And I thought maybe just to get started, if we could sort of point out some of these things and perhaps just get a quick remark from yourself with regards to those things. I mean, for example, if we talk about death with dignity, well, what does that imply to you?
You know, what Kokuamau is emphasizing is how we can best care for people who are in the last chapter of life or people who are seriously ill. So I'd like to explain that palliative care, and a lot of people misunderstand this. So palliative care is a type of care that helps to address, for people who are seriously ill, the suffering that they may be occurring, whether that's physical suffering, pain, symptoms, so shortness of breath or constipation or other physical symptoms. But we also look at emotional suffering, spiritual suffering, and then social concerns. And palliative care it's a field of medicine, but it's very much a holistic approach. So on a palliative care team, there would be a nurse, a doctor, social worker, chaplain, perhaps someone to help with other sorts of psychological issues, a nutritionist. What we really try and do is look at the whole person, so patient-centered care, but also who is that person's team, their loved ones, their family members, a community that's helping to support them. So it's sort of two teams that work together to care for somebody who's seriously ill. So, you know, hospice,
the term palliative oftentimes is quite a abstract concept for perhaps many people in the community. And I'm glad that you are trying to, you know, at least clarify what that means.
Yeah, you know, that's one of the most common questions I get. What is palliative care? Isn't it the same as hospice care? So hospice is a very important service that we have available around the islands, and they care for people who are in the last 6 months of life. So again, the team approach is the center of hospice, trying to manage all of the issues that a person may have, as well as supporting their caregivers, their family members and loved ones. So hospice is a type of palliative care, but you can also get palliative care, for instance, someone who's in the middle of cancer treatment, having side effects from the treatment. They can get palliative care to deal with those things, and then if the cancer treatment is effective, they wouldn't need palliative care anymore. So it's really if you can think of it as an extra layer of care, an extra layer of services to help people. So what I find all the time is people say, oh, but isn't that the way things work usually? So for those of us that are trying to manage loved ones' care, we know that sometimes the doctors don't talk to each other, that there's not a coordination of effort, that medicines might be counterindicating, or there isn't a social worker who can come in and help sort out whatever it is, the bills, or how is this working. So for me, that's really the difference with palliative care, which is why we're so pleased that palliative care is really spreading around Hawaii, and it's really, it's great to see.
You know, sometimes we hear of feudal medicine, you know, where a person perhaps might be 95 perhaps, or maybe a little older, and there's some discussions about the need for some major surgery, for example, and there may be some conflicts within the family that results as a result of this particular kind of discussion.
Yep.
So, and this is where Kokua Mau and the palliative care issue comes up.
You know, for us, we started about 12 years ago here in Hawaii, and our first slogan was conversations. And 12 years later, our slogan, the main thing to do is conversations. These are not easy topics, but they're very important. These are some of the most important conversations that you can have with loved ones. And the type of care that people get as they get sicker it's very difficult to figure out exactly the right way to go. And as you say, there can be a lot of stress among the kids or the people who are doing the caring, because we all want to provide the best possible care. But sometimes the best possible care is not another surgery or aggressive treatment, but the best possible care is emphasizing the comfort and the wishes of the patient. So for us, we like to put the wishes and the goals of the patient at the center. Listen to that as we develop a care plan. You know, I can think of my friend whose dad had heart surgery at 92. Very weak heart, 92. Unfortunately, he passed away in the hospital in the middle of this surgery. We tried to talk about it ahead of time. Family didn't want to hear about it. They thought this was going to be the curative thing. You know, I think it's really important for us to recognize that none of us get out of this life alive. We all have a limited amount of time. We don't know how long that's going to be, but let's be realistic. Let's look at quality of life. Let's look and see what's possible. Not to say we shouldn't ever do any treatment. That's not what we're talking about. What we're talking about is what's appropriate. So we want to avoid unwanted, unnecessary care that's going to increase the suffering of people.
Let me turn to another question here having to do with maybe one of the couple words that oftentimes we've used in the past. Living will, advance directives.
Right.
Are these terms still used? Are they still important? What do they mean?
Absolutely. So an advance directive is something that everybody over the age of 18 should get. So for people who are listening and thinking, oh, this has nothing to do with me, wrong. You know, Forbes magazine, all kinds of Money magazine, everyone says you should have an advance directive.
Which means?
So an advance directive, and again, you can find all of this information on the Kokua Mau website. An advance directive is a document that will express your wishes for your care at the end of life if you cannot speak for yourself. So it's very important in our country and our laws allow the patient to have the word about what's going to happen with them. So there's sort of two parts of an advance directive. One part is appointing what's called a healthcare power of attorney or a healthcare agent. Who is it that's going to speak for you if you can't speak for yourself? Okay? So this is really important for people to think, and to think about who's going to carry out your wishes.
Right, someone that you can trust, yeah.
Right, and if you have one kid who's not agreeing with you at all, they might be the eldest son, but they might not be the right person to choose, or somebody who lives far away or is inaccessible. And they don't necessarily have to be a family member. This can be a person that's going to follow your wishes. So that's appointing the healthcare agent. And the second part is what people think of as the living will portion, which is, as I approach the end of my life, what kind of care would I like? And there's two basic questions, mostly looking at resuscitation of the heart, if that should stop, and then tube feeding. But again, these are conversations. So for me, what I would like people to think about first, start with the conversations about what care you want, and then you can document that in an advance directive. And then as people approach the end of their life, then to also document it with a
Now,
post.
so why is an advance direct? Maybe this is an obvious question, but why?
No,
why
not
would-
at all. You know, I think it's very important for people to remember, especially those of us that are not clinicians. We have a lot of advances in medical care. So we can try a lot of things. So I referred before to my friend whose dad at 92 went in for heart surgery. We can do that. But that's not necessarily that's not necessarily the type of care that somebody's going to want, and people can choose whether or not to have those treatments. So I think a lot of people have seen around them whether their neighbor died well or getting care that they didn't want. And an advance directive, helping to prevent the crisis, helps you to document your wishes and figure out who's going to speak.
So if
for
you
you.
don't have one, what are some possible
You know, I could tell you
consequences?
all kinds of horrible scenarios, but if you can imagine, so I was thinking of somebody who didn't have an advance directive and they had 6 kids, 3 grandchildren,
Okay.
and I think there were 2 brothers.
Okay,
All those people can show up to have an opinion about what's going to happen to you. You know, what you really want at the end of your life is for people to be saying goodbye, hopefully to be remembering you, to be laughing about things that have happened. You don't want your loved ones in the hallways of the hospital fighting about your care.
Right.
And you also want your wishes to be carried out.
Right.
So if by appointing a healthcare power of attorney and having these wishes spelled out, the end of your life can be like you want it to be.
and you don't have to have all that conflict within the family at the very end.
Absolutely. And I don't know how many times I've heard from people 20 years later, they're still not talking to the other parts of the family
Right,
because they didn't talk about that.
yeah,
And then, why are you killing mom? I'm not killing mom. This is the...
yeah,
And so it's difficult. And, we all have our dysfunctions in our own families,
Sure,
right?
sure,
So just
yeah.
because you've arrived at a crisis situation or the end of someone's life doesn't mean everybody's going to have a perfect family. And I think those misunderstandings and disagreements inside a family come out in these moments of stress. So much better to get it documented so that at the end of life, people are concentrating on what's important.
Now, one of the other new words that is coming up with Kokua Mau
Yeah.
and with the entire palliative care movement is this word called post.
Right.
And your organization has been advocating and supporting the
Right.
use of this particular procedure. Tell us what this means.
Right. So, and again, you can get this information off of our website. In Hawaii, we were the 8th state in the United States that implemented POLST. So it's P-O-L-S-T.
We have a slide that points out what those words mean, and perhaps you can
Right.
share some things about that.
Right. So physicians' orders for life-sustaining treatments.
Uh-huh.
So what's very important about this is that the P is for the physician or for a provider. For physicians to make orders that document what somebody's wishes are. So I mentioned before the advance directive. So we're back, if you think we start with conversations, first thing to document is advance directives. Then a post is appropriate for somebody where the doctor would say, I wouldn't be surprised if this person died in the next 12 months. This is somebody who's more seriously ill, perhaps approaching the end of life. We don't know exactly timing,
Right.
but we've hopefully had conversations in the hospital. So for instance, you've had conversations in the hospital. Somebody's transferring from a hospital to a long-term care facility. Let's talk about what those wishes are. Do you want resuscitation, yes or no? Tube feeding, yes or no? What kind of treatments are we going to try? This can help, and then you can document those wishes in a form, so it's a bright green form. Again, you can download it from the website, and those wishes can be transferred with the person when they leave the hospital to the long-term care facility. So they leave the hospital, they go to the long-term care facility. Those folks take out the bright green form and say, oh, okay, this is where we are with the patient.
And that's a physician order, huh?
It's a physician order, so it's very important to remember an advance directive is not a physician order. So if you take it to a nursing home for long-term care facility, rehab, it's important to have an advance directive, mostly to figure out, well, who the healthcare power of attorney is.
Okay.
But you can't, like EMS cannot act on that. The medical director cannot act on that. If somebody's been sent home after they've been in the hospital, and then you call the ambulance, they can act on a post. So for instance, if someone's having trouble breathing, you can see on their post, okay, let's transport them back to the hospital, get their breathing under control, then they come home. We're not going to go back to the ICU, we're not going to try surgeries, we're not going to do other things. Or it outlines what that care plan is.
So the family keeps a copy of this green form at home?
Correct.
And you also have a duplicate copy at different locations, as with the doctor's office or at the nursing home as well?
That's right. So you really want that to be visible. So I usually joke with people, you know, pin it to your chest.
Okay.
Think about that as it's moving with you.
Moving with you.
So if somebody's at home, you put it on the refrigerator or the back of the door, you want it to be visible, so EMS can look and say, oh, okay, there it is. Or if somebody's transferred to a long-term care facility, you bring it with you and you give it to them and you say, good, this is our post.
I think we have a second slide for the post that we can also see here. And you can perhaps share some of that information.
Yeah, exactly. So, you know, this term, this word actionable, most of us don't use that every day. But if you can think of it as it's physician's orders that EMS can take actions on. So there's a doctor that signed the form, very important. With the post form, a doctor is going to sign that form. It's not something that you can do by yourself. It's something that you do with a doctor. And the second point, so portable, it means that you can go from the hospital to the nursing home. So let's say somebody goes from the hospital, they go to rehab, then they go to a nursing home. In all those places, the post is valid. So it can move with the patient. Again, EMS, that emergency folks that read this, they know what to do. This has been accepted by the Department of Health. As I said, it's part of a movement across the United States, and we really see it as the best way possible for communicating your wishes. So, and it allows, it's different from, you know, a bracelet that is a do not resuscitate bracelet, because that's one thing.
I see.
As opposed to a variety of different choices.
Instructions. Yeah.
Instructions.
I see.
And the shades of gray, it's very important because very few people have a black and white situation.
Right.
We're going to try this, we're not going to try that. Yes, we'll transport you, and then we're going to try this. Or else you can say nothing. We're not transporting, we're not doing anything, whatever.
Now, we have also another slide that shows a comparison between the post and the advance directive, and perhaps you can kind of explain what we're seeing here.
Yeah, exactly. So this is a good slide to remind people of what we're talking about. So again, an advance directive, anybody over the age of 18. A post, you want to think about people who have serious or advanced illness. So again, that question, and it's a question to ask the doctor, would you be surprised if somebody died in the next 12 months? Okay? The purpose is of the advance directive, to talk about your wishes, your values for end-of-life care, and then to appoint a person who's going to speak for you. Who is your agent going to be? The purpose of a post is a medical order which takes those patients' wishes, those values, and puts them into action that people can act on. So the next part is the same. EMS cannot honor an advance directive, so that's very important for people to understand, but they can honor a post. But the advance directive is very important for not only appointing the healthcare power of attorney, but for directing then future actions.
So where can we get this particular form called a post?
So one of the good things is we were very happy here in Hawaii that we were able to pass this bill, but there was no money attached to it, so everything connected to post is connected to Kukuamau. So please visit our website. You can download the form for free. If you can't, you can phone Kukuamau. We can send it out to people. We also have an advance directive that we're happy to send out to people. If people are interested, they can also request a speaker who, so if you're thinking, wow, my Rotary group should know about this, or my caregiver support group, or my church or temple, we have speakers that will go out and talk about POLST and talk about advanced care planning. So again, that's something you can contact Kukuamau about.
So tell me a little bit more about Kukuamau. You shared some things in the beginning.
Right.
Perhaps we could, the community could benefit from that.
Sure. So we work on a variety of different levels. We really try to help people who are facing serious illness and their loved ones to understand what kind of decisions they might have to be making. So for instance, we have some fabulous new explanations about what is CPR and what is tube feeding. A lot of people, so for instance, on television, CPR is very effective. 92% of people who get CPR on television get up and get better. So, you know, George Clooney comes in, performs CPR, everybody's looking good and running the marathon the next day. Among seriously ill, especially older people, it's about 2% effective. Oftentimes, CPR will set up a series of other events and not be effective, so that you almost have more problems than when you started. So we think that it's really important for people to understand that. So please go to our website. You can join our free newsletter. Again, you can ask for a speaker to come. We're more than happy to get people this information.
I see.
So, yeah.
So, with regards to Kukuamau as an organization, now you're an umbrella organization for other organizations, for the most part, right?
Well, you know, I mean, umbrella might be the wrong word, because it might imply that I can tell somebody else what to do, which isn't the case. So each of these independent groups are part of Kukuamau, because we believe that on a statewide level, there's a lot of collaboration that's possible. You know, here in Hawaii, it's pretty small. We all know each other. We try and help each other out. There's no need for all of these different groups to be creating materials. If Kukuamau creates the materials, everybody can use them, everybody can benefit. So that's really what we try and do. And so the next thing we try and do, besides working with people who are ill, is to help professionals to get education and networking so that they can understand, you know, they can provide the best care possible. And then finally, we look at policies. So for instance, like POLST, or now some of these new innovative things that we're doing with HMSA, for instance, where we're really trying to impact the whole state and improve the care. So, you know, here in Hawaii, we're really doing a lot of very innovative things. I think a lot has to do with our culture and the fact that we all collaborate and we know each other and we're interested in helping each other out.
Yeah.
So we really are doing, you know, we should be proud of what we're doing here in Hawaii and what's happening. So people are welcome to join Kukuamau. We need both individual and organizational members, and also to come and participate and to, you know, to take advantage of the resources that are there.
Well, it's, you know, it's just wonderful that this organization was formed, as you mentioned, you know, to deal with some of these issues that oftentimes we don't talk about as readily, but it's for the greater good.
That's right.
I mean, it helps minimize family conflicts, perhaps. This whole issue of quality of care at the very end. These are so important.
Yeah, and you know, I find over and over again that people are just so hesitant to talk about it, that by not talking about it, crisis happens. So as a public health person, I'm always interested in preventing crisis.
Right.
No, it's not an easy conversation, but hopefully people can inform themselves, take a deep breath, and talk to their loved ones. Time to talk to mom about these issues. Talk to the person you're caring for to make sure that these questions are taken care of, because for almost everybody it's going to be relevant, it's going to be needed. And so much better to talk about it ahead of time, get some of these things said when you can say them, as opposed to wishing. You know, that's often so hard when people will say, oh, I wish I'd had time to talk about that one.
And it's not as though we cannot change our minds later on, of course. So
Absolutely. I mean, thank you for saying that, because these are all forms that can be changed anytime. They can be ripped up, they can be modified, but at least the conversation is starting.
Yeah, yeah.
So, you know, if people don't hear anything else, think about this: conversations, plural conversations, to be really listening to people, listening to your loved ones. What are their issues? What are they concerned about? What can you be doing as they move forward?
Now, I wanted to go back to that last slide that we were showing there with the name of the organization again, and your phone number, and your
Right,
website.
and the website.
Yeah.
We have a lot of great information. It's nice. I get email messages at 2 o'clock in the morning from people who said, my mom is in hospice care and she's in the end of her life, and your website was so helpful. You know, for me that makes it all worthwhile. So,
right.
and I know that these are not easy conversations.
Absolutely not. Yeah.
But again and again, we see how important they can be.
Right.
Important for preventing crisis. Important for recognizing how hard it is to be a caregiver.
Yeah.
And so we really want people to feel supported.
I'd like you to come up with one last tip for our viewers. You know, they've heard so much information from you. If you had to share just one tip for them, well, what would that be?
You know, start today.
It starts today.
Start today. These conversations that I've been talking about, how can you start it today? There's always going to be some reason to not start it today and put it off and whatever. Start today. It's a series of conversations. It's a process. You may have to go and find more information. So much better to do it ahead of time, to be prepared, than to wait for too long and then not be able to talk to your loved one, not be able to talk to the doctor, and to have this whole crisis happen. So my thing would be start today.
Start today. Very good, very good. Thank you so much.
Oh, of course.
Jeanette.
I hope people will contact us.
Yeah. So this is about the end of the show, a topic having to do with end of life and how we can help our doctors help us. So thank you, Jeanette Kojane from Kuku'amau, a wonderful organization that we have in the state of Hawaii. This is a great resource. So again, thank you again for watching our program, Kupuna Connections Television, and hope to see you again next week. Aloha.